I just really want to talk at this moment about one strategy that I think is the single biggest thing that you can do to improve your life and support your physical and emotional well-being. And best of all, that is free. So we're talking about breathing. And I'm sure some people will be thinking, well, you know, we all take in enough oxygen to live. We think we're breathing adequately. I was in my late 30s when I realised I wasn't doing this properly. And I think the symbolism of this is really important when you consider two of the biggest world events right now. So obviously in COVID-19, being unable to breathe is a crucial symptom. And actually we've all seen those images of people who are intubated with the tubes going up their noses and really struggling to get air and oxygen. And then I think the other world event that we can't ignore is the murder of George Floyd and his last words, "I can't breathe." So I think that phrase, "I can't breathe," is emblazoned in all our minds at the moment. And George Floyd literally couldn't breathe, but not being able to breathe is also really associated with fear. I run a specialist service for men with histories of very extensive childhood trauma in a high secure prison. For some time now, we've run activities such as yoga and mindfulness at the start of therapy. And we do this to help them become more emotionally stable, because we know that they're about to embark on a really difficult journey to address the therapy, to address their underlying childhood trauma. And at the moment, the men are locked up for a significant part of the day, so that we're not running a therapeutic regime at the moment. We can't run treatment as usual. So we've been trying to help them keep stable and identify what we can do to strengthen their coping and not waste their time, but give them a skill that also will help them on that therapeutic journey. So at the moment, we're kind of like developing more resources to help people actually breathe better. So good breathing involves breathing in through the nose, and that's absolutely essential. And I think that's the thing that most people get wrong about breathing. So we need to breathe in through our nose and deep down into our abdomen. And we should only be breathing at 5 to 6 breaths per minute, which is actually much less than most people breathe. And actually, if you're 6 foot tall or more, then really you should only be taking 3 breaths a minute to get the right level of oxygen into your body. I think the fact that intubation tubes go up through the nose might indicate that nasal breathing is important. And how we breathe out is much less important. But if you use your mouth to breathe out, it's likely that you're going to fall back on breathing in that way during the day. So why is mouth breathing so bad for us? If we breathe in through our mouth, we take in too much oxygen, and then we don't have enough carbon dioxide, which we actually need to release the oxygen into our muscles and to help regulate our blood's pH levels. If we breathe efficiently, then we release less free radicals as the oxygen converts to energy. So breathing in through the nose is associated with less inflammation, and inflammation is implicated in all aspects of health within our entire body. We're also less likely to feel physical and mental fatigue. Our concentration levels improve. And crucially, when we're thinking about the virus, is that actually our noses catch germs as we breathe in through our nose, and that doesn't happen when we breathe in through our mouth. So breathing in through our mouth exposes us to a lot more virus that we really could do without. The other thing that happens in our nose, and it only happens in our nose, is that when we breathe in through our nose, it stimulates nitrous oxide. And nitrous oxide is implicated in reducing our risk of heart attack, and it helps our bodies stay in balance. So it's involved in antiviral activity, so it strengthens our immunity. It also ensures a healthy libido and genital functioning, and it helps our brain and the neurotransmitters within our brain work effectively. When we breathe in through our mouth, we activate our chest, and that activates the stress response. When we breathe in through our nose, we take that breath more deeply into our stomachs, and that activates a calming response. And as we breathe in, basically our body becomes more aroused, and as we breathe out, our body calms, and our breath kind of acts like a bit of a seesaw, kind of like swinging to and fro. So as we inhale, we stimulate our sympathetic nervous system, and that excites us, and we get ready for fight or flight, and it stimulates our heart rate and dulls our digestion. As we exhale, then that stimulates our parasympathetic nervous system, and that relaxes us, calms our heart rate, and stimulates our digestion. So if we're doing a lot of breathing in through our mouth, what we're doing is keeping our body with a sympathetic dominant, so we're more likely to be on the edge of arousal, whereas actually breathing in and out for an equal amount of time and ensuring our oxygen levels are balanced and our breathing patterns balanced keeps us in a state of equilibrium. I think just one final point about breathing is that our stomach holds our enteric nervous system. And in the last 2 decades, Europe and America have woken up to what those in the East have known for a very long time, that our mind and body are intertwined. And we know that our guts and the neural network in our stomach sends more messages to the brain than it actually receives from the brain. So 90% of the fibres that pass up from our stomach up through the vagal nerve into the brain are sending messages up to the brain rather than receiving messages from the brain. And nasal breathing helps our enteric and autonomic nervous systems work in synchronicity. So what we find is that the sympathetic nervous system has the opposite rate on our stomach that it has on our heart. So it stimulates our heart, but it calms our stomach. And the inverse is true of the parasympathetic nervous system. In our stomach, there are 30 neurotransmitters, and our stomach also holds 95% of our body's serotonin. That's the chemical that's associated with well-being. So actually gut health is really important in terms of well-being and immunity, and it's really heavily associated with nasal breathing. And I just want to finish with a reference to Professor Emran Mayer of UCLA, who said that in future, psychiatrists are going to be as interested in what's happening in our stomachs as they are in what's happening in our heads. Thank you.